Influence.
All kinds of buttons on it.
Oh my gosh.
There's always like, I remember I had it like,
Between that and the world.
I had like a metallic shirt on and all the, didn't think about it, I got so hot.
All right, ordinarily I have a little clipper. That's a me problem. We can still continue with the presentation now. So welcome everyone. My name is Dr. Eric Kaler. I'm founder of Physical Achievement Center, and you're at a workshop to learn about how to improve your strength and balance to stay active and strong. Does it sound like everybody's here for that reason? Mm-hmm. Great. So the presentation will be pretty straightforward. Before we begin, I just want to cover a couple things. First of all, can everybody hear me okay? Mm-hmm. Good. Secondly, there's two bathrooms. One is through this door, third door on the right, and then across the hall, first door on the right. If during the presentation you have some questions or you have some needs, raise your hand. These go differently each time, and that's fine. Some people like to ask a lot of questions during it, some people who don't, who reserve. It doesn't matter to me. I will talk from now until the end of the presentation. I actually prefer more questions, but what the general format is going to be is I'm going to be introducing myself and why we're here at Physical Achievement Center. I think it helps you understand who we are and what we're about. And then I'm very interested in hearing about what brought you to the presentation, your particular challenges as it relates to balance and strength, so that I'm sure to include some content if it's not already built into the presentation that's pertinent to you and valuable to you. Fair enough? Mm-hmm. Today we're going to be able to see a demonstration of a balance device that we use for a majority of our patients who are challenged with balance and movement disorders, called the Proprio 3000. And we'll get a chance to see that, and then we'll let you know what the next best steps are for those of you that want to carry on the conversation forward. You rolling there? Perfect, thanks. All right.
Just making sure.
So, the one thing, Robin, I'm sorry, would you...
Charger?
No, we're good on that. I'm going to need some to drink, and so either a water glass or something would be so kind. So, we help people achieve greater strength and mobility for their active life without medications, drugs, and surgery, even when nothing else has worked. That's been the mission of the clinic since we've started. It's actually strengthened over time for a couple of reasons, but I'll tell you a little bit about that. Thank you kindly, appreciate it. So I've got a slide presentation for this, and that's a sort of recent picture of team members at Physical Achievement Center. But I had worked for a good number of years in the physical therapy profession in a lot of different capacities. Had the honor of not only completing my doctorate, but getting a fellowship training in physical therapy, which involves understanding how to relieve pain and improve function from the head down to the toes. And I realized there's a huge gap between what research shows and what we see in the clinics and what people are offered for advice when they go to their medical providers. That gap, since I started the clinic in 2017, has grown even wider. That there appears to be not enough discussion and space for things that don't necessarily involve, well, just live with it, you're old. In this instance, what do you expect? Maybe here's some medications, shrugging shoulders, go for a walk, that sort of thing, and that doesn't really lead to meaningful advances in people's lives, nor does it really reflect the reality of how powerful some of these approaches could be. So that's why I started the clinic, to be independent from the big providers, so that we could give straightforward advice. We treat patients. We're not concerned about what some administration might feel. I have a healthy respect for medical doctors and providers, but I'm going to give advice based on what we see in terms of what's best for that person in front of me, so we want to make sure we have those appropriate conversations. We're aiming to we've done workshops like this since we began, both here in the clinic and outside the clinic, and this is a great way to get an introduction to individuals, meet them with their questions and challenges. We want to help educate people so that they can make better healthcare decisions. And if by that they want to work with us for their problem area, great. If not, that's okay too. I really feel I have a duty to educate the public about what's available that doesn't involve medication, drugs, and surgery. And that's the skinny of it, why we're here. And certainly not to disrespect, and I think this is a clicker, it's not. Certainly not to disrespect anybody by saying, what do you expect at your age, or you just have to live with it. That is not acceptable. If a provider or any of my staff said something like that to a patient here, we'd have a very straightforward talk about reorienting that conversation. It's not part of our lexicon here. So let's talked a little bit about myself. Dr. Rebecca is here. She's got over 10 years of experience. A little bit about the team, and then we'll get to you. She's got a fellowship in applied movement science. She's a phenomenal Dr. PT. Been with us for, I think, 2 years now. Dr. Jessica is in a fellowship training program now. She's certified in vestibular and balance disorders, and she is a certified dry needle practitioner as well. Jean is a physical therapist assistant who is specially trained in pain relief and sports recovery massage, certified spine specialist, certified upper extremity specialist, Courtney, physical therapist assistant. With over 6 years of experience, she's specially trained in pain relief and sports recovery massage, certified spine specialist, certified upper and lower body specialist. Lori Shates, she has got over 30 years of experience in the occupational therapy space. She was one of the first calls that I made when I wanted to open the clinic. She's a fierce patient advocate. She's a specialist in that edema, swelling, lymphedema area, and she teaches and mentors nationwide. There's one more person that we don't have a slide for, and that is Robin. Most of you have met Robin, so I'll let her introduce herself and her, or would you rather me do it?
Yes.
Okay.
Yes.
So Robin Barber, Robin Barber has been on our team for I think a little over a year now, and she has experience as a radiology technologist.
Yep.
Am I saying that correctly?
Yep.
She understands the implication of wellness lifestyle and understands all things wellness and health, if you will. She is leading our neuropathy program here at Physical Achievement Center. We'll mention that a little bit in the presentation today. And she also assists in the front desk as we develop that neuropathy program further. So,
That was great.
Okay, perfect. Great. So we're going to talk about the major parts of the balance system, and then we'll talk about how it all goes together. For the first one we talk about is a sensory motor system. Sensory motor system is a big word, sensory and motor. And this illustration here shows, and what we tend to think is that the brain sends signals to our body parts to do things, which is true. That's the motor portion of it, the information coming from the brain. But the sensory portion of it is our body parts are reporting all the time back to our brain from a number of different things, right? So that's the integration of the feedback going out, feedback coming in the motor going out. They call it the sensory motor system, and the brain has to make sense with all that. So that system is heavily reliant on body sensation, felt sensation. We'll talk a little bit more about that, but think about it this way. All your joints have joint receptors. Those joint receptors have receptors that tell us about the position of that joint, the movement of that joint, the speed of movement of that joint, and that is one big part of information leading to the brain. For instance, without hitting your neighbor in the head, raise your arm out to the side. Everybody's going the same way as me. I could lead a dance routine here. So what I'd like you to do is close your eyes and bend your elbow to 90 degrees or a right angle or a bookend. So with your eyes closed, bend your elbow to a right angle, and now look at your elbow. Most of you are plus or minus 5 degrees to a right angle, right? Lower that. You're able to do that. You can lower your arm. You're able to do that because your brain can feel the position of your body in space through some of your joint receptors. As it pertains to balance, the bottom of the feet are real key. So the problems with neuropathy is you don't have as much sensation on the bottom of your feet, but there's thousands of sensory receptors on the bottom of your skin of your feet that are reporting back to the brain. There's receptors in the ankle. So when we do an ankle sway, if you can imagine that I'm on a boat and I'm standing up and I'm rocking in the waves, that's an ankle strategy, right? Where I'm balancing. I could also sway from the hips. That's a hip strategy, right? So the joints of my hips, ankles, feet, knees, all the joints are reporting information to the brain. There's other joints as well. Certainly any joint in the body is sending information to the brain about its position in space to create a nice depiction or image of that in the brain, in the sensory cortex. The muscles themselves have sensory organs. So most of the time we just think, oh, muscles are just kind of some meat that we kind of use to help us do things. But the muscles themselves have organs in them, little sensory organs that send information to the nervous system as well. So individuals who may have a challenge in the sensory motor system, they would notice that on firm floor surfaces like this, they feel a little bit more confident. On carpeting surfaces, maybe a little less confident, right? So that might be some indication that maybe that sensory motor system is a little bit challenged because you don't feel as much on a squishier surface as you do on a firm surface. Who here thinks they have ideal ankle, hip, and knee flexibility? Anybody think they got optimal knee, hip, and ankle flexibility, right? So if you have stiffness in those joints, and we know that joints send information to the brain, is that joint able to send very good information to the brain if it can't move fully? Absolutely not, right? So it's very common, you know, the ankle should flipper back, ideally about 15 degrees for most individuals who are in this room, maybe even a little more. I find it routine that some people barely get beyond a right angle. So in other words, if it's a right angle, you bend it a little bit past that, that's gonna change the way that joint sends information to the brain and change the way that joint can respond to movement when we move. Eyes, we use our eyes for balance. We're looking for in the environment vertical and horizontal lines. Think about when help a little kid ride a bike, get them going, look up. So the eyes can scan for horizontal lines, right? We also scan for vertical lines too, right? So that information comes in the nervous system and helps to create an idea in part of where we are in the world. We've all had probably a sensation of our car moving when we're at a stoplight.
And the truck comes in.
And someone else in front of you starts to kind of creep up out of the corner of your eye, and you feel like you're going backwards, right? Our eyes are picking up information, and we're feeling like, hey, maybe we're moving, right? So we're always trying to pick up movement. So individuals who may have trouble with at least integrating information from their eyes or maybe seeing with their eyes for stability will have more problems when there's crowds or there's movement by them. There's more distractions. Eyes closed. If someone closes their eyes and their balance is a little bit more disturbed, that means those other systems aren't as fine-tuned as the eyes, and it's typical that an individual would really become really dominant with their eyes to lock into the environment to compensate what they can't feel for in some of their other body parts. So most individuals who are balance impaired are going to have rely a little more heavily on eyes, and as things happen with our eyesight, that can influence that, right? Dark at night influences that. Vestibular system, this is one of the favorite areas, and I've got a little model of this. So this is looks like a little something you'd see at the bottom of the creek, sea, if you will, around a coral reef, but this is your vestibular system, and this is really cool. So you've got the nerve that reports to the brain, and this is just behind your eardrum, very small organ. I'm going to take out the window here. So you have two different main components of it. You have this part called the cochlea, and in it you have these circles that form like a snail. Inside of that are small finger-like projections that also are in these areas as well. Those finger-like projections can move in response to movement of your body. It responds to movement linearly vertically, going up and down in an elevator or going through the world. Maybe one of the reasons why people feel a little bit tired when they're a passenger driving is because that system is stimulated. These semicircular canals respond to movement in the 3 dimensions we're going to move. It's got heavy, thick fluid. What I've learned recently is one of the reasons why, I don't know if anybody else has maybe once or twice in their life had a little bit too much to drink and they get a little spinny.
Never.
What actually happens is the fluid inside of here, the density changes. It isn't as thick. Some of the alcohol seeps into that system to make us dizzy. So kind of cool to know, but this is representing the part of the bones of the ear that are responsible for hearing, but this is the vestibular system. I'm going to pass this around for people to play with. I think it's kind of cool, so by all means, take a look at some of those features there. So people who have difficulty with their vestibular system, when they turn their head or look up or down or horizontally, they might feel woozy, like something's spinning. They might have a lot of trouble when they're going from lying down to sitting or sitting down to lying, or unfortunately like reaching up like this. That can really expose them because not only is their balance challenged, but their center of gravity is higher, and if they spin, they're at risk for falling, right? So dizziness could be the world is spinning, could be that they feel spinning. And these individuals might feel like they can't ever get steady. In the slide right now, we could talk about the Proprio 3000. We're going to have a demonstration of that, so you'll see that instead. So how does all this fit in? The one area that I didn't specifically talk about is the upper cervical spine, the neck. So the first couple of vertebrae underneath the neck, their sensory nerves go to a little hub or a little nerve bundle. That little nerve bundle is very close to the same nerve bundle that the inner ear system goes to. So they're like neighbors. They go to the same train station, but not on the same train tracks. So when your neck has a dysfunction, chiropractors might term it, you're out of adjustment. We don't necessarily think in those terms here in physical therapy space, but we would just say when you have tightness in the base of your neck, when you have muscle spasming, when you have pain in that area, when the joints are stiff, you have dysfunction there. And that, because of that dysfunction, the brain can misinterpret that as a balance problem. So there's 2 disorders that can happen specifically because the upper neck is not in balance. One is cervicogenic dizziness, that means neck-caused dizziness, and the other is cervicogenic headaches. You can have both. You can be blessed with both. Aren't some people lucky? And this is something that is a little bit less commonly understood, and something that absolutely should be known more about. Because if we're trying to help someone improve their balance and we don't look at their neck, they may do everything under the sun and still won't get a lot of relief. First time I had this experience, I was in Indiana. At a clinic, I was doing some training, and there was I actually met a jockey, a retired horse jockey, and he had been in lots of trauma and injury, as you can imagine when you're on horses. He had actually had so much balance, vestibular therapy, conventional therapy, that actually one episode he actually fell off a physio ball and injured himself further. But I was with the gentleman that I was training with, the Dr. PT, and I said, well, I think this person needs this dizziness training again. He's like, look further. So we looked to his upper neck. We found a couple of significant dysfunctions. We did a little bit of work in that area, and immediately his balance measures were better. It took him just a couple of sessions focused on treatment in the neck to fully restore his balance, whereas he'd already been doing all the sort of balance things. That was for his case. So cervicogenic dizziness, cervicogenic headache, that one will have to make the cut, just like we need to add Robin's slide in here. We'll need to have that specifically in here. All right. So this is the funnest slide of the day. Like this is fun to me to talk about, right? So before I do that though, any questions, comments so far? If you don't, that's okay, but.
Well, it seems like you look at the whole body. It works together, which is nice to hear. I've been to so many doctors that like it's only your ear and that's how they look at, you know, or it's only your arm. You know, connect the whole body. So is that what I'm getting out of you?
You know the term mic drop? Boom, that's a mic drop moment. That's exactly precisely it, right?
Yeah.
Yeah, for sure, right? I just think, I just, like when I got out of physical therapy school, I thought that we were kind of trained like you find one thing to work with, whether it's orthopedics, and you just work on that one thing. Well, at that time, MRIs just became really popular. And guess what? A lot of people had MRIs. Guess what they found? A lot of problems that really weren't problems, they were imperfections. And then guess what came afterwards? Arthroscopic surgery. They had a huge deluge of arthroscopic surgery, and when they researched it, they found that most of those were unnecessary. So that's one of the harms of just looking so isolated, right? So there's really, it's difficult to tease out. We don't move around as knees or inner ears or heads, we move around as a person. And this is just a model of how it incorporates. This is a very simplistic model, right?
So how does a dentist fit in here?
How does a dentist fit in here? Well,
Right, with the jaw and...
well, yeah, we didn't even, well, so that's interesting. So if you wouldn't mind, make sure the camera is adjusted at a reasonable height so I don't want to look like I'm talking from underneath a trailer or something like that. So the balance of the jaw right to left is in part assisted with the upper neck area. So it's, for us, when we work with TMJ problems, we're going to want to first balance out the neck and upper spine, typically. So if you do have difficulty in the jaw and you have lots of pain, that's a massive level of irritation of the nervous system, and that can definitely throw the system off. I think, Carly, I don't know if you've seen this statistic in your schools, or schooling so far, but I recall that up to like 70% of your sensory information comes through one nerve in your body, or trigeminal nerve, in your nervous system, 70%. So if there's a problem in that, that's going to occupy a lot of space. So I'm not sure if that answers your question or not, but the other thing is, yeah, I mean, certainly even if you're in a dental chair and it's not positioned properly, that can induce some strain for sure and cause some problems. I'm not going to beg on dentists, right? I had, you know, orthodontics as a kid, and as I started loosening up my upper spine, being an adult physical therapist, I could feel some of that tightness that was in there when my braces were tightened. So yeah, that gets our attention real quick when our teeth are bad, for sure. All right, brain at the top. Information going out to the body this direction, information coming back to the body in this direction. This is a very simplistic model, but you can think, most people think we just tell our body what to do. Arm move, right? But fortunately, I don't have to think about my postural muscles. I just kind of hang out here and they do what they do. Muscles of movement, the big muscles that you'd see on a well-developed bodybuilder, those are muscles of movement. Those are volitional muscles. I have to activate those to grab my water and grab a glass of water, right? But my postural muscles hold me upright. Both those muscles are active and do receive some input from the nervous system. So when we change positions from some sort of movement, then all of our other organs start to change, right? If we're moving our position in space, then the eyes are changing their orientation, the inner ears sensing things, and the body joints are sensing their things. All that information is coming in the central nervous system. So mechanoreceptors, that's basically a fancy word for the sensation that you get on the bottom of the feet. Proprioception, that's kind of through the muscles and the joints, those sensory organs that come into the brain. None of you are taking notes here. I didn't tell you about the test later on, so hopefully you're all good. Just kidding. The vestibular system, like I said, looks like a little snail at the bottom of the ocean or bottom of the creek, right? And then our vision. So we know some things happen over time, right? I mean, some individuals might develop tendencies for neuropathy, right? So then those mechanical receptors kind of go away. Something else has to try to make up for it. Tightness in ankle joints, knee joints. Okay, this one gets cloudy. Over time, like I'm not big on saying there's age-related changes, in part because I'm getting older every year too, and I don't want to admit it, but part in my mind, we can always improve our movement ability. Like people look at me and, do you think I can get better at my age? And I'm like, that's the furthest thing from my mind. Like everybody can get better, right? But there's something that does happen. The vestibular system it has some changes over time, and that's why probably we don't like swinging on swings at a certain age, right? Is because there is some changes in some of these systems, right? We know vision can change over time, right? Cataracts and acuity of vision, that sort of thing, right? So when there's challenges to one system, something else better try to make up for it, right? So that's basically the key, is that, hey, which of these systems, the neck is not on this chart, but which of these systems, or the neck vertebrae, which of these systems might be not giving the brain proper information to incorporate? Does that make sense? So that's kind of how it all fits in. Which backs us up to the question is, oh, shucks, that's not the right order. Is it possible to have more than one issue, right? Yeah, of course it is, right? Most individuals, regardless of whether they come to us from an orthopedic issue, whether it's just a simple knee injury or back injury, if it's a balance issue, there's a whole number of systems that we need to start to lock in on so it's individualized. Someone with a inner ear problem, they're not going to get as much help if we're working on muscle strength, although muscles usually need to be strengthened, right? Lots has to go on for this to work right. Your inner ear and balance center has to work right. Your brain has to process information properly. So there's where it comes in. Like the cool thing is, like what's a big area of brain research these days and concern?
Alzheimer's.
Dementia, Alzheimer's, that sort of thing, right? The cool thing is, I mean, this is just up the road here at UW-Madison. They're doing phenomenal research, concluding two things. Look, if we eat a bit healthier, and we all know what that means, which most of us do, unless you live under a rock, right? And if you move more, both of those things serve as some protection against dementia-related neurocognitive decline, social engagement, exercise, all those sort of things literally grow new brain cells. That's pretty exciting. Because we, like what we were all taught, you have so many brain cells as an adult, don't drink too many of them away. Because you might need some of those later on, right? Nothing's further from the truth, right? That our brain grows new cells if we remain active and engaged. We know that from research, that's well documented. So that's really cool. But the speed of processing, yeah, is that going to change somebody in their 60s versus their 50s? Yeah, that speed is going to change a little bit, right? But medications may also change that, right? So there's an aspect of that too, is that if you have, you know, your medication levels, there's a certain therapeutic dosage that gets you the benefits you want. And if you just keep going a little bit over that, not only will you not have any more benefit from that medicine, but your potential side effects will, the risk of the side effects affecting you will start to skyrocket. So always appropriately dosing your medications. And are there medications that are harmful? Absolutely. My stepfather, before he passed away, he had significant balance disorders because he didn't have good eyesight. He had a bad knee. He used a cane, right? Do you think I would let him get on a sleeping pill? Not a chance. He had a bad prostate. Got to get up and pee 5 times a night. If you're impaired mentally, can't see, can't feel your knee very well, got to go to the bathroom. No, I don't want him on that. Let's find something else, right? That was for me, right, and my family. Muscles have to hold you upright. Who here thinks they have the muscle strength they need to be robust and strong for the next 5-10 years? Ish. One person's kind of, maybe, right? Like we know intuitively we don't have the same strength. Why would our body maintain a muscle mass if we don't challenge it? Our body's all about homeostasis. If we don't stimulate those areas with vigorous work, repetition, that sort of thing, the muscles will be foolish to worry about keeping more of that around. The body's very wise that way. Muscles get strong at any age, it matters, right? Strength of your quad muscles, strength of your side hip muscles. I was literally going to a presentation for this, carrying a little whatever information pack, walking on the sidewalk. I tripped on the sidewalk and I had to do this, otherwise I would have face planted.
I do face plant.
So there's that stepping strategy that requires a powerful response and a quick response. Well, if my muscles had become weak or had some sort of pain issue, that pain shuts down muscle activity in that area that it has, then you can't respond, right? So the muscles have to respond too. We didn't talk about that a whole lot, but those muscles have to be strong and robust. So we have to make sure we pay attention to that. Joints have to be flexible. Like I mentioned, most people have tightness in their hips and their ankles. And how many people have a hard time bending backwards in their spine? So they start to, from loss of flexibility, they start to, this is their life now, right? It's hard to get upright, right? Because they've lost that stiffness. So we're going to talk about how to get better balance and avoid the next fall and remain independent. That's what we're all basically after, right? And some general guidelines. So basically, we want to stay safe and not fall, but we also want to live our life, right? So what does that mean for everybody? I don't know. I've had an 83-year-old woman who wanted to water ski. That's not most 83-year-olds' idea of fun. That's fine. So everybody's got to kind of figure out for themselves how active they want to be, what sort of things are they excited about. Golfing, you know, going on walking tours. Sometimes even just walking to a pavilion in a park across grass is a challenge for some people, right? Hiking, that sort of thing. So there's general advice that we can give out. General advice would be, does anybody know what furniture walking is?
Or you grab furniture as you go.
Yeah. What could be the harm in that, right? Right. So think about it. Your body's purpose is to keep, from a balance perspective, is to keep your center of gravity, which you could just kind of think of as your caboose, over your base of support, which is your feet. If you're furniture walking, you're shifting your caboose potentially outside your base of support repeatedly. Your brain no longer recognizes that as human movement. You're staggering like the town drunk, to be honest. I'm not criticizing, I'm just saying, if you feel the need to kind of walk by something and hold on to it, it's your body's naturally telling you, you don't feel safe, like hold on to that, okay? Maybe you need an assistive device, or maybe you need to get that addressed, right? But stop furniture walking and use a device if your ego will let you.
So in my house, I tend to